see that.
Some California doctors hope stem cells can help people see better longer. They're putting together a study to see how patients with macular degeneration react to stem cell injections. For now, they're only testing about 24 patients. It could be a while before they come up with any definitive new treatments. And here in the studio today, we have Dr. Brenda Forbes from the Austin Diagnostic Clinic, and you're here to talk about child eyesight, correct?
Correct.
Right.
Yes.
This is an important month for it, correct?
This is the Child Vision Awareness Month, and I guess there's just really one point. I kind of like to go to the end, and then we can kind of talk about the beginning. Children need one dilated eye exam. Everyone says, you know, you need to go to the dentist every 6 months or get your eyes checked every year. But I guess my biggest message for my patients is that we can't really measure the true child's vision unless we do it with a dilated eye exam. And if your child were to have something that we could fix with glasses or vision therapy, sometimes people have a lazy eye, or you see the little kids that have the glasses with the patch and they have to kind of work the weaker eye. If we can catch that at least by age 5, we can do something to help. But a lot of times I'll get the siblings of some children, and they're, you know, maybe 14, and they have these problems, and I have to tell the parents, I'm sorry, we needed to see it before your child was 9 or 10. And that's I guess my biggest message, is that a lot of parents don't realize that, well, surely the pediatrician's office will pick that up, and they do for the most part, but the more subtle things that the children have, like starting kindergarten or you know, first grade, and they're supposed to be doing a lot more focusing tasks, and little kids have a hard time telling parents, I think, that I don't want to sit here, I want to go play on the playground, and their parents are thinking, well, they're just being distracted, and maybe it's just, you know, maybe it'll get better as they get older, and they just kind of put it, you know, on the back burner. And that's, I guess, what I want to tell parents, is that if you do have those extra health dollars to get the one dilated eye exam, don't just rely on the vision screenings. Those, for the most part, will pick the sharpness of your vision. They'll measure how well you can see at a distance, or maybe just for that minute the child can really squeeze their eyes. We call that accommodate. And even if they have these far-sighted problems or the astigmatism or even like a weaker eye, they can turn, and they can sometimes pass those screenings and still really have needed this help and have that kind of JPEG quality vision. That's kind of what I'm here to say, is it's, you know, the big problems are going to get caught, but those more subtle problems that I would want for my children to have the best 20/20 vision they can, really, for some kids, don't get caught till it's too late. So that's kind of the end story. But there's a lot of little things that are up that, you know, the most common, you know, vision problems usually are like nearsightedness, farsightedness, astigmatism, those kind of things. But I guess that's my biggest point, I guess, that I wanted to tell parents this morning.
Right. Oh, so if a parent does suspect that a child does have, you know, maybe a vision problem, what's the thing that they need to do? They need to go straight away to there, or can they talk to their pediatrician?
I would start with you. I would personally probably, of course, I would see my own child, but I mean, I would start with my pediatrician. They usually can kind of help talk out what kind of problems it is. Is it an eye turn? Is it that they're rubbing their eyes, itching? Maybe it's an allergy issue. But I think the pediatricians would, since you're already doing your yearly well check, I think that would be a very smart place. But you know, if your spouse has a vision plan and you can go and just get that annual checkup, I don't think it's wrong just to go straight to your, you know, eye care practitioner and just go ahead and have that dilated eye exam. The problem is the pediatrician's office, they're not dilating children's eyes, and I really think it's important to get those muscles relaxed to truly measure what's going on there, because that's really the only way you can rule out these more subtle ailments that I just kind of described, you know, scenarios setting up for preschool or kindergarten. But that's a really good age, because, you know, at that age, kids can recognize letters, and they can help give what I call subjective feedback. So we can kind of use a combination of their interacting with me as well as the objective, meaning they don't have to say anything, measurements that we do in the office. So I like that age, and it's a good age just to go ahead and make that the first one if you haven't already done so. So I think that's the biggest point that I kind of wanted to share this morning.
Great. Well, thank you for being with us. Let people know how we can get in touch with you.
Sure. Thanks, Josh.
Sure. Good. Do you want to tell how they can get in touch with your clinic?
Yes. You can call our office, 901-4014, and they can help you. We have a couple of 2-3 different people there at the office, as well as myself, that can see children.
Wonderful. Thank you so much for being with us.
Thank you.